We spend our entire working lives saving for retirement. We picture the travel, the gardening, maybe just sleeping in on a Tuesday. But there's a silent budget killer that almost nobody accounts for until they're standing at a pharmacy counter staring at a receipt in total shock.
It's the classic retirement curveball. You plan for the mortgage to be paid off, but you forget that as you age, your body becomes a bit more high maintenance. And the cost of maintaining it? That is where the real surprise lies. Today, we are tackling the beast known as Medicare Part D.
Part D, the drug coverage. It sounds simple enough on paper, D for drugs, but in practice, it feels like trying to read a map in a foreign language while driving 60 miles per hour. Why is something so essential so incredibly complicated?
Because it's a hybrid beast. Unlike Part A or B, which are direct government benefits, Part D is actually private insurance that is merely approved by Medicare. It's a marketplace. You have premiums, deductibles, co-pays, and co-insurance all dancing together. It's not just, here is your card, get your pills. It is a financial strategy game.
And like any strategy game, if you don't know the rules, you lose money. Let's break down the structure because I've heard horror stories about the phases of coverage. It's not a flat rate, is it?
Not at all. Think of it less like an insurance plan and more like a road trip with changing tolls. First, you have the deductible phase. You pay 100% of the costs until you hit a set amount. That's the entry fee. Once you pass that, you enter the initial coverage phase. This is the normal part where you pay a copay, and the plan pays the rest. Everyone is happy here.
Right, but then the road gets bumpy. I've heard people talk about the donut hole. It sounds almost pleasant, like a bakery stop, but I'm guessing it's not.
It is decidedly not delicious. The coverage gap, or donut hole, is where the math changes. After you and your plan have spent a certain combined amount, the plan steps back. Suddenly, you are paying a much larger percentage of the drug costs out of pocket, usually 25%. You fall into the hole. It's a shock to the system, because you're taking the same medication, but suddenly the price tag triples at the register.
That feels incredibly counterintuitive. Just when you might need the help the most because you're taking enough meds to hit that limit the safety net lowers?
Exactly. It forces a difficult question about the economics of healthcare. We punish the sickest simply for needing more care. Now, there is a light at the end of the tunnel called catastrophic coverage. If you spend enough to get through the donut hole, your costs drop significantly for the rest of the crowd.